highly committed to his job. He has a lot of knowledge and experience.
He's a person who wants to see things changing.
If you talk about Professor Janabi, everyone knows him.
He says, whatever you do, make sure you leave your mark.
I'm Professor Mohamed Janabi, a passionate advocate of public health and medicine with a robust academic background and extensive practical experience in both fields, public health and medicine. My journey in public health and medicine began with the pursuit of multiple academic degrees. My dedication to public health extends additionally. I have served as a senior advisor to the President on health policies and nutrition since 2024. So my commitment in strengthening health system in Tanzania has been unwavering. I've actively advocated for universal health coverage and enhanced pandemic preparedness with early response, improving healthcare delivery across the country and outside the region.
He's very good at advising, You sit down with him, he'll just give you an education, why there is this problem, what needs to be done. His biggest concern with me was, or advice with me is, please, President, make sure that you control weight. And you control weight with choosing what you eat. If there's an issue, anytime, call him anytime, even at night, you'll say, I'm coming. He's highly qualified for the job. He has worked for many years, from the smaller hospitals up to the national hospital. He worked at the Muhimbili. He has a lot of knowledge and experience on the medical profession. When I was president, he has been one of the advisors on healthcare development in the country. That's when we came up with the idea of developing the primary healthcare development program. That time, Professor Makusa was the Minister of Health. They worked closely in the development of that. He's all round. He's well-rounded, well-versed on the issues. I've worked with him for 20 years and still remains my physician. He's the person that deserves that.
The critical thing which I see from Professor Janabi is his skills of being a really transformative and visionary leader. He really wants to see that we're sustaining the health services, not only of Muhimbili, but beyond Muhimbili, the entire country, looking also how it can also benefit the regional, African region countries. So he also came up together with the board in tapping into identifying critical investments that we can embark on. These are health investments. In terms of financing, through his leadership in collaboration with the board and the management team, we've been able to define different investments, health investments, that we can embark on, which are worth $570 million. And these investments are at different levels of engagement with the private sector, but also with the government, and these private sectors not only from within the country, but outside the country as well.
He had focused on increasing of innovation, like motivate the specialists to do super specializations, make sure that we as an entity, as the surgical entity, to think outside the box, not do business as usual. So with the innovations that we have done, it had helped us first to actually improve the services that we do at the hospital. But then the other thing that was of his major focus was to improve primary health. He made sure that we do camps at least every other month and outreaches. The outreaches were done in zonal hospitals, regional referral hospitals, and district hospitals. Now, all these hospitals are actually equipped with proper infrastructure, specialists, but then the only thing they're lacking is the skills to actually perform the basic surgeries. So what he has done is to actually conduct the camps and the outreaches for the specialists and super specialists from Muhimbili National Hospital. We go like a team of doctors, nurses, anesthetists, and pharmacists to actually go and impart knowledge to our colleagues. That is one aspect. But then the other thing is that to make sure that we actually treat those patients in their areas. That was his vision, and that vision has actually been realized.
He is an advocate of universal coverage. I remember when we started to implement the primary healthcare development program, he could always speak to us. I remember during that time I was working as a district medical officer, and later I was promoted to become the regional medical officer. In these two positions, I did encounter with him, but in all of his conversation was about how best are we going to achieve universal coverage through primary healthcare development program.
He's like a role model and a father figure to me, because whatever I am today at JKCI is because of the professor. And Professor Janabi wants two things. He wants hardworking people and ethical people. He's very high in ethics. In the past, people used to go to India for the medical treatment, but now 95% of the all procedures in interventional cardiology are done at JKCI. And this is because Professor Janabi started looking into how to transform the health sector, especially cardiology in Tanzania, by bringing people from outside, saving government money, saving cost of sending patients outside for treatment. Now those money has been used to treat locally and at an affordable cost.
Professor Janabi is a visionary leader. That's what I can say. He strengthened the cardiovascular disease treatment through collaboration. So we start working with collaborators from all over Africa, from all over the world. And through his vision as a collaborators, believing in a collaboration, now we are also coaching other hospitals. Zambia is under our care. They are creating their health facilities for cardiac disease treatment, and we are supporting them.
In terms of financing for the surgical directorate, Professor Janabi has managed to get different partners outside the hospital, whether it's banks, whether it's friends, whether it's NGOs, to actually be part and parcel of helping or enhancing health in the country. This just doesn't hold water for the hospital. So he goes out of his way to actually look for partners to assist in a certain project, because then we know what the project is going to do for the country as a whole or for that community.
And then one thing which I think also we must recognize is his engagement. He was very also much engaged when we were defining the universal health insurance bill of this country. There's a lot of consultation with the politicians and with the decision makers, technocrats, academicians, and even selling the best practices of Muhimbili. And finally, we're lucky we had this universal health insurance approved by the parliament and endorsed by the president. And so he was part and parcel of its development of the universal health insurance.
But apart from that, he has been assisting us with health promotion and health education through various programs which he initiated. And that is very important. As you know, that prevention is better than cure. And to him, that has been his approach in making sure that we're meant to have a healthier and a prosperous nation. To me, Janabi remains to be a role model, not only to Tanzanians, but his performance and his vision goes beyond our nation.
So when President Samia nominated me, it was really that moment of pride, and I was so humbled. First, it reminded me, oh, I'm recognized, not only by my patients, but by the president also. But it also came with this feeling of, oh, now I'm going to have even a heavier responsibility to improve the health of Tanzanians and beyond. So to me, I'm grateful, and I will not show her down.
We all know Professor Janabi is a champion of prevention and health promotion.
Is the right choice and the right candidate who would take forward the name of Tanzania and held together the medical fraternity in Africa.
Being visionary, being resilient, being persistent, and being able to bring the level of services to the public the same way as the one that is a private, I would take that as a good leader.
Prof Janabi is very charismatic. He's diligent. But the one thing that gets us all in one line, he is goal-oriented.
He's the best person for the job, no doubt. We expect a lot from him, and Africa will benefit a lot if Janabi becomes the director of WHO Afro.